Hello, my name's Alex Chapman. I'm a physiotherapist in Woburn Sands, Milton Keynes. And I wanted to just take a moment today to give you some information about the Mummy MOT, which is a new service that we are now offering at Enliven Health. The Mummy MOT is an in-depth physiotherapy assessment of the postnatal woman. Now that may be from 6 weeks after you've had your baby to 6 years or sometimes more after you've had children. And it doesn't matter if you've had them naturally, if you've had assisted deliveries with forceps or ventouse, or if you've had a cesarean section. Really doesn't matter. So the assessment is for all postnatal women. And we strongly believe, together with other women's health physiotherapists, that this is an essential service for postnatal women and should be available across the board for postnatal women. In countries abroad, France, women have thorough postnatal treatment to assist in their recovery. Unfortunately, in this country, it's not the same way. And you have your 6-week check with your GP normally after you've had children. It doesn't really go into much detail about how you're recovering in terms of pelvic floor and tummy function. And a lot of women end up later on down the line experiencing problems. Really because things weren't picked up properly or dealt with when they should have been. So the Mummy MOT is an hour-long assessment which looks at the functioning of your pelvic floor, of your tummy, and it also screens you for biomechanical issues. So whether that may be problems with your posture or problems with your low back or your spine or your pelvis, problems in how joints are moving. That again could well lead to problems developing in the future if they haven't done so already. So a woman doesn't necessarily have to have problems to have the Mummy MOT. The idea of the Mummy MOT is that we screen you for issues that are there that may not necessarily be causing problems now, but could potentially cause problems later on down the line. It's often the way that women feel okay after they've had their baby, but then it's not until later on in life. For example, when they go through the menopause and you have a very rapid drop in hormone levels, and that's often when a lot of women start experiencing issues. When actually, if things had been dealt with perhaps a little bit earlier, then you could perhaps suggest that, things could be a little bit more manageable in the future. The other side is that we really want to try to increase awareness to women that a lot of symptoms experienced after having children are not normal and are not, there's this mentality out there at the moment and this message being conveyed to women that having incontinence or having, prolapse symptoms or even pain, even low back and pelvic pain, are normal and are to be expected after you've had children. This is not the message that we want to be conveying to women. There is plenty that can be done to help you if you're experiencing any of those symptoms. And that is another sort of aim of the Mummy MOT, is to identify any problems that are present and to then treat accordingly to hopefully provide you with some relief if you are experiencing symptoms either from incontinence or prolapse or pain, and to prevent all of these things if you're not currently experiencing symptoms, preventing them from being an issue later on in life. So what does the Mummy MOT involve? Well, it's an hour-long physiotherapy assessment, and it's an in-depth assessment. We will be looking at your pelvic floor and your tummy. The pelvic floor exam is normally performed internally Obviously, this is done with your consent, and obviously, ensuring that you're comfortable with this procedure being undertaken. It really doesn't sound as bad. It's really not as bad as it sounds. It's not painful. There is nothing like a speculum or anything like that inserted internally. And what we're really looking at is how the pelvic floor is functioning. A lot of the time, women are advised to do their pelvic floors, however method that, not necessarily taught how to do this in the correct way, but anyway, and it's not always actually the strength of the pelvic floor that is the problem. The pelvic floor may be strong, but it's actually the fact that it's overactive, or it's in an overdrive, or it's tight after you've had your delivery, your baby. So it's not always an issue of strength and not being strong enough. It might also be that it's tight, and that tightness is causing a restriction, and that is obviously then causing problems. Again, it could be causing problems with incontinence symptoms, or pain. So that's the first thing we need to establish. Are there any problems going on with your pelvic floor? The other thing is obviously the tummy. So when you're pregnant, obviously your tummy muscles lengthen by about 50% by the end of your pregnancy, and they separate a little bit to accommodate the growth of your baby. Now, normally this tummy separation does resolve. However, in about 30 to 40% of the postnatal population, this does not resolve naturally. So women will have a rectus diastasis abdominis, which is essentially a tummy separation. And if they've still got this 8 weeks after they've had their baby, this will not recover unless they rehabilitate it in a very specific way. And it's often the case that women think, right, got to do my crunches, got to get on, got to get my six-pack back. This can often make your separation worse. It's very important that you rehabilitate rectus diastasis abdominis in the right way. Otherwise, you can lead to further problems. You can actually make the separation worse. And that can ultimately lead to further issues: back pain, pelvic floor dysfunction, urinary incontinence, and the list just goes on. So it's very important that these things are checked. And the message that we want to really get out there is that this check and assessment should be a standardized assessment for the postnatal lady. Unfortunately, it's not the way at the moment, but that's what we want to be trying to encourage. Postnatal women, whether you are having problems or whether you're not having problems, get checked just to make sure that everything's as it should be. You're doing all the right things, you're exercising appropriately, and you're not putting yourself at risk for having further problems later on in life. The other message that we want to be putting out to postnatal women is that symptoms such as urinary incontinence, whether that may be on a stress basis, for example, if you cough or sneeze or blow your nose, or if it's more of an urgency incontinence. So if you feel like you need the toilet all the time, or if you feel like you've got some kind of urinary tract irritation, neither of these types of urinary incontinence are normal or to be expected after you've had a baby. And please don't feel like this is something that you have to live with now if you are experiencing these kind of problems. It should never be a case of thinking, okay, I've had my children, this is how it's going to be now, reach for the tenor pad. It's really not, the way or the message that women's health physios want to be, received by women. So urinary incontinence, fecal incontinence, Symptoms of prolapse, so feeling like there's something heavy down below, some women report symptoms like a golf ball or such like, pressing down, which often gets worse as the day goes on. Again, problems with actually passing water or stools, problems with the flow. Anything like that is really not normal and really should be checked, because it is something that can be treated, and you would be surprised. There's very good outcomes with exercise, pelvic floor rehabilitation in pelvic organ prolapse. And the other thing is low back pain. Low back pain, pelvic pain, very, very common during pregnancy and postnatally. But again, it's not something that is to be expected or something that you need to be living with now. This is something that can be addressed. Often there is a link with what's going on with your tummy and with your pelvic floor. So in a nutshell, the Mummy MOT will screen you for problems, whether you're experiencing symptoms or if you're not. Because as I've mentioned before, you may be feeling fine, but there could be an underlying problem that could arise later in life. So it's a good idea to get checked. As I said before, we will look at your pelvic floor, we will look at your tummy, we will screen you for any postural problems or biomechanical problems that could be a contributing factor to any symptoms that you might be having. Once we have undertaken this assessment, we will give you a report which will detail all of our findings, any issues that we've identified. You will then have this report for yourself. You can either keep it for your own information, or you can share it with your GP or another health provider, whatever you prefer. So you will have a copy of the findings that we have identified, and then we can also plan where to go and what the appropriate route would be for your treatment. It might be that you need to do some exercise, specific exercise, either for your tummy or for your pelvic floor or for both, for your back, and we will give you a specific exercise program that is tailored to suit your individual needs, and you will have this program to then continue with at home. You will also have an option of attending for further treatment if appropriate, and that could involve really a number of different routes, whether again it will be exercise based, or it might be focusing on release of any tight structures identified, strengthening of any weak structures, or even manual therapy of the spine and pelvis. So there's lots and lots of different avenues that you can go down to help restore yourself essentially after you've had your baby, and to get back to normal. So that is essentially what the Mummy MOT involves. It's £75 for the hour session. We are also offering a cheaper alternative to the Mummy MOT, which is called the Express Postnatal Check. This is a half an hour session and will cost £35. We will still go through your medical history. We will still ask you what symptoms you're experiencing, but the actual assessment procedure will not be as in-depth. We will still look at your tummy. There won't be as much pelvic floor assessment, but we will be able to advise you about, appropriate treatment routes for you to go down if you are experiencing symptoms. And if you're not experiencing symptoms, we will check, make sure that you haven't got any rectus diastasis abdominis, and we will give you a few exercises to go away with. So that's a cheaper alternative to the Mummy MOT, but obviously it's not as thorough, shall we say. We will also be introducing a Mummy MOT class in the new year. And this will be aimed at postnatal women who have had either the mummy MOT or the postnatal check, the express postnatal check, who want to then continue with an exercise program, a safe exercise program that is appropriate to their problems, and we will be running that in the new year, and we will keep you updated, keep you posted about that. That will obviously be a group session. So if you do have any concerns or questions, or you know, if we can offer any further advice on anything, please do get in touch. The contact details are email info@enlivenhealth.co.uk, or you can give us a call on 0844 884 5424. And we're always here, you know, if you want to ask us a question, you know, never feel that, you know, you feel silly asking anything, or you know, it's a trivial, you know, concern that you have. We're always here to listen and to advise. So don't sit there and suffer in silence. If you are having symptoms, get in touch. If you're not having symptoms, then again, if you would like to get checked, make sure everything's as it should be, then please do let us know, and we look forward to hearing from you soon. Take care now and have a good day. Bye bye.